Hey everyone, it's Dr. K. Welcome to my YouTube channel. If you are new here, actually I'm pretty new here to YouTube. My name is Kaylee McIsaac and I am a licensed naturopathic doctor in Vancouver, British Columbia, Canada. So I work with patients here in the realm of natural fertility. I want to help you get pregnant, stay pregnant, and thrive in new parenthood and beyond. Today, we're going to talk a little bit about testing for your ovarian reserve, or how your doctor gets an estimate or an idea of how many egg cells and maybe even the quality of the egg cells that are left in your ovaries. So let's get straight to it. There are 3 general tests that your fertility doctor or your naturopathic doctor like myself might use to help us estimate what we call your ovarian reserve. Women are born with all of the egg cells that we will ever have. So actually back when we were fetuses in our mom's uterus, we had all of our egg cells at that time. And as we grow and develop, we go through puberty, we start ovulating, we are losing egg cells sort of every single day throughout our entire lives. And with every cycle, we lose at least 100 follicles or egg cells, and sometimes even more than that, depending on the cycle. So we're losing egg cells all the time. Luckily, we're born with many, hundreds of thousands, if not millions of egg cells. So for us to lose a few hundred every month is really not a big deal. But as we come closer to the end of our menstruating life, so in our 40s, that number can fall pretty precipitously. That's why we have a lifespan, our reproductive lifespan. We cannot parent children through our entire lives. Once we hit menopause, we stop ovulating, that stops. When you're younger than that though, and trying to conceive, it's a good idea to have some testing done to estimate your ovarian reserve. And what I'll say off the bat is that there's really no one single, fantastic bulletproof test that can tell you, look, you have, 700,000 egg cells left in your ovaries. We don't have a really specific test like that. But doctors use a combination of these 3 tests to give us an idea of where your ovarian reserve is at. Keep in mind that these numbers should always be interpreted in the context of your age. So for someone to tell me, for example, hey, my AMH is blank, 1.0. What does that mean for my ovarian reserve? We really can't tell you very much unless we know a little bit more about you. So how old you are and if there are any other conditions happening in your system, like for example, PCOS. But these give us a rough estimate of where your fertility is at in comparison to other people your age. So the first test is called an FSH test, or follicle stimulating hormone. That should always be tested on day 3 of your cycle. If you don't know what that is, day 3 of your cycle is considered your 3rd day of true menstrual bleeding. So day 1 is the first day of bleed in your cycle. If you're the type of person who spots leading up to their cycle, those days of spotting don't count, and it's the day of first full flow that would count as cycle day 1. Then on day 3 or day 4 is acceptable if for whatever reason the lab's closed or you can't get there on day 3. On day 3 or 4, you go into a lab and have your blood drawn and they will check your FSH. As we age, our FSH rises. What FSH is, it's actually a brain hormone. It's the signal from your brain that gets released in the early part of your follicular phase, the first half of your cycle. It's your brain communicating to your ovaries that we want some follicles to develop. So let's grow up some follicles so we can have one ready to ovulate in a couple of weeks. The older we are, I think of it as like your brain has to now yell at your ovaries to get them to respond, because there are fewer egg cells and the egg cells that are left are of poorer quality. They don't respond as well to the call of FSH. So we can take a look at your FSH value, and again, considering the context of your age, consider that the higher the FSH, it's an indicator of a lower ovarian reserve. Now, one little caveat when it comes to testing your your FSH is that we always want to do what's called anchoring your FSH with an estradiol or an estrogen level. What happens is if your estrogen is really high on day 3 of your cycle, it does something to the FSH value, which is that it falsely suppresses it. So that means your FSH might look really fantastic. It might look lower than what it actually would be if your estrogen value was lower. So in Canadian values, you want your estrogen to be below 200. And if it is, that means that your FSH reading is pretty accurate. In general, we like to see an FSH of less than 10 international units per liter, so IU per L, on day 3 of your cycle. Beyond that, anything higher than 10 indicates both that you might not respond as well to IVF medications, because a lot of the IVF medications actually mimic the action of FSH. And then they also indicate that you might expect to retrieve egg cells that are of poor quality or grow embryos that are of poor quality. So ideally, we like the FSH below 10. The second test is called an antral follicle count, and this is not a blood test, but it's actually an ultrasound that's done early in your follicular phase as well, where the ultrasound tech or your fertility doctor will count the number of growing follicles on each of your ovaries. So they're called antral follicles, and they can see them. They're much larger than the other follicles in your ovaries, and they'll count the number that they see on each side. So your doctor might tell you, for example, hey, we see 3 on the right side and we see 4 on the left side. So that would give you an AFC of 7, the combined total of the antral follicles in both ovaries. In general, we like to see a combined AFC higher than 6. That's a pretty reassuring number of antral follicles in a cycle. Again, generally, the lower our ovarian reserve, we will tend to see fewer antral follicles when they do that screening test. But 6 or more is generally considered reassuring. The last test for looking at your ovarian reserve is called an AMH, or an anti-Müllerian hormone test. This test can be done on any day of your cycle, so it doesn't have to be done on day 3, but it's often included on that day 3 blood work. And it's a blood test that's done that looks for this hormone called AMH that's released from non-growing or non-dominant follicles. The higher your AMH means that the pool of available follicles is generally considered higher. So we want the AMH to be higher as an indication of a better ovarian reserve. Now, AMH specifically is one of these tests that we absolutely have to interpret in the context of your age, because an AMH of 1.0 for a woman who's, let's say, 38 or 40 might be a really fantastic value, but if you're 28 and trying to conceive and your AMH is 1.0, that might be considered low for your age. So again, there's no hard value where we could say we really want it to be like 2, for example. We want it to be appropriate for your age, or you might be told that your ovarian reserve is slightly better for your age. They might compare you to someone who is a couple of years younger than you. That would be a favorable reading or a favorable interpretation of your AMH. So those are the 3 tests that are done to assess your ovarian reserve. That's your day 3 FSH with an estradiol, your antral follicle count, and then the anti-Müllerian hormone. Let me know what else you want to know about your natural fertility in the comments below, and thanks so much for being here with me today.